I'm going to show you what you can kind of expect to come out. On the very first night, pretty red and kind of thick. Totally normal. You might see some little blood clots and things like that in it. And if you really think about it, it's better to have this out of you than in you. So that's what the drain is for. So let's say that's day one. By the second day, it'll thin out, kind of a lighter version of the same color, sort of like Hawaiian Punch. And you're still going to see some little junky clots and things like that in there, but again, it's better to have it out than in. Third to fourth day, it's something like this. There are some small chunks of clots and things like that. Again, it doesn't look appealing, but it's good to have that removed. And then you get to the next day, and now it's really light in color and still has some little things floating around inside of it. And hopefully by that last day, which will be maybe day 6 or something, might be day 7 for some patients, you see it really getting almost clear and still has some little junky things in it, but that actually will be coming out in the drain and not sitting inside of you. One of the things that happens with these drains is that all of a sudden the patients will feel like nothing's coming out of it, maybe it's ready to come out. It's very important when these drains are in that you kind of milk it, which means holding it somewhere near the skin and just kind of gently pulling along the tubing, because sometimes something gets stuck in the tube and it prevents anything from coming out. And if you see drainage coming out from around where the drain is exiting the skin, that means the tube is blocked. So you have to make sure you clear that tube so it's actually working and getting everything out of there. I make the decision to take the drain out based on how much drainage there is. Very important to keep track of it. So every time you empty it, make sure you write it down, record date and time and the amount of drainage, and record it in milliliters. Makes it a lot easier to figure out when it's ready to come out. This is a drain output record. We'll give this to you either during your pre-op appointment, or you can always find it on the website. You can print it out as a PDF and be very careful about keeping track of everything. When we make your appointment that's around a week out, we're going to have you add up everything that's come out over the prior 24 hours, and that's what I'll base being able to take it out on. What I'm saying is, don't be too worried about the drain. I think you'll feel better than you would have if the drain weren't there. So just keep in mind, the drain is actually not that scary of a thing. If you have any questions about taking care of it, or you're not sure how to record it, or if the stuff that's coming out of it, you're concerned maybe doesn't look right, just call us. We can walk you through it. It's really easy. So have a good recovery. If you liked the video and you found it helpful, please click like at the bottom of the video and subscribe to the YouTube channel. There are lots of very informative videos that will make your pre-op and post-op time a lot easier.